Welcome to USMLE Sarthi. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Hey guys, I'm Dr. Arora. I am a PGY Ford and the Chief Resident at Prisma Health, University of South Carolina. I have been doing this with Mr. Pavan here regarding personal statements and reviewing CVs and discussing with mentees coming every year about what they can do to make their application grow. Because as we all know, in the last 3 years itself, things are changing rapidly. So I'm here today to talk a little bit about the importance of personal statement. And I think we'll go through a presentation that I'll do in the beginning. And during that, you can always write your questions, but most of them I'll take them after the class. And after that, we can go through some examples as to, what is the right way of approaching it. All right. Let me share my screen here, guys. Okay, this is going to be my screen. Great. Can you guys see my screen?
Yes.
Okay, great. All right. Welcome everybody again. Like I said, we'll discuss today in detail about the importance of personal statement, the important aspects of it, how to kind of make sure that each paragraph of yours is catered towards what it should be. So the person reading it, of course, they get a good idea about you. And then hopefully they kind of take you for an interview and then, you match into your dream residency. All right. So what is a personal statement, right? So think about it, like, this is the first filter that people are going to look at. You've done your scores, you've done your you've gone to the US, you've done rotations over there. Those are objective data that you've worked hard on getting good scores and worked at good hospitals. But there is some personal aspect to your application. When you work under someone, they don't just look at, okay, we want the most intelligent person or the smartest person around us working for us, become a resident. Where the way I look at it is that they look more for someone who has a good attitude. And how do you find something personal about someone is, of course, when you interview them, that's the later part. Before then, they kind of want to filter you out. So your personal statement is the first, you can say, the vision that they have into your own personal self. So here, how you word yourself. Are you too boastful? Are you too timid? Are you talking about yourself in a manner that people want to listen to it? Those are the very important things that you want to make sure that are there in this personal statement, because this is the first thing that they know and read about. And accordingly, they decide, whether they want to keep you, they don't want to keep you, or even think about you. So that's the importance of personal statement. Now, what is one? So I would say that it's your journey. There are, unlike CVs, unlike a lot of things, the application personal statement usually doesn't have any rules. Of course, you don't want to go too long, you don't want to finish in a paragraph. It's just some basic things that we've learned over the period, and not just for medicine, it's for a lot of different job applications and master's applications. You don't want to do that. But in general, what you write within that is your own story about how you started, where you came from, how you went about it, why you choosing this, what makes you a good candidate for this, and then what will you do later on. So it's just dividing into small things. That's what they want to know about you. Here we want to take out the things that may not be very pertinent to them, or we want to add things that we feel like, okay, they may not seem pertinent to us, but they may look good on an application, or they actually define a lot about your personal characteristic. So it's like your own story. So you want to write, and like when we all go see movies all the time, we come out after seeing a movie. Okay, this movie was good, or the story was good, but didn't act well. The direction was good. The screenplay was good. So here you kind of have, like the power to make your own story look the way you want to make it look for someone else. Now, this is not videography. This is purely on text. But I still think, having read a lot of personal statements myself, being with Sarthi last 4 years, I'd say that when I read through a personal statement, I more or less know who I'm going to interact with, what kind of conversation I'm going to have with them when I interview them or when I get to know them, or what CV I should be, looking to it. Okay, this is the CV likely of this candidate only because I know how they've written the personal statement. So it tells a lot about you. You may not think it, but it tells a lot about you. It's a lot of different skills. So this is your chance to tell your story in your own manner, and you want to make sure and guide you that you're doing it in the manner that is presentable and likable by your program directors. So this is this sorry, why I went too ahead. Yeah, so this is what the main structure is. We'll get to a lot of things later on, but first we get to what to do, what not to do. I need to tell you what is one and how do you structure one. So I gave like an example about a couple of lines in the previous slide when I was talking about how you divide it. um, Not everybody, it shouldn't be haphazard, right? You can't start with, oh, I wanted to become a doctor. I came to the US, and then you go back to say that growing up, I always saw this happen and this made me interested in this field. It should follow a pattern, just like your life. It should follow a pattern. Things will always happen here and there. So, how do you start it? Now, the introduction. I would say the first paragraph, this is like I've made different paragraphs here. I would say you can make up to 7. I think that's okay. The body wants the third and fourth, maybe something that you can make 2 paragraphs out, but others I would say just keep 1, so this structured well. The first one is the introduction. Now here in the introduction, I don't think this should be really long, because this is giving an insight into your life, and this is before you start, like you answer questions when you're in school, you give a brief overview before you start into jotting the points. So I'd say similar there, you want to just give a brief idea. Now how do I start it, right? One of the very few things you can do is uh, start with something that you feel like is important to your career, why you came here, why, you know maybe you always had doctors in your family, and growing up you always saw a lot of healthcare, medical care. Growing up you saw a lot of people, disabled, destitute, probably a lot of morbidity or mortality around you, and there was like a turning point that may have seen, which can come on later if there is a story going on. Growing up, this is something that you had no idea about. You got interested in some way or the other. Maybe your teachers thought you were good at it, in school. Maybe your parents thought you were good at it. Maybe something struck you that this is why I want to do this. So I would keep the first paragraph up until the point that why I even thought about doing medicine. More than, if you are so clear in your head that, maybe you're applying for residency right now, but you already know that you want to become a critical care physician, a cardiologist, then you can also write about that. But if you don't have very strong feelings or very strong things to support yourself why you want to go that far further, I would just start simple, that this is why I wanted to become a physician in the first place. This is why I thought that this will be a good plan for me. So you can think about your mentors who kind of shaped you towards it, someone who played a very important part of your life, part in your life. So something like that in the first paragraph, that I came from a place like this and I felt that this is something I always liked. I had a lot of like a lot of people around me doing that, or someone guided me towards it, or something like that, which is kind of the start of the story. um the second one, this is why you're telling them why you want to do this thing in particular. When you become a physician, there are lots of things that you can do. We all know the subspecialties, right? We usually talk about medicine, or family medicine, or psychiatry, pediatrics, neurology is more one of the common IMG friendly fields. But surgery, right? I think that's a massive field, surgery. If you are so sure about it that you want to become a surgeon for so and so purpose, this is where you can give a brief idea in the first line, first paragraph itself, and then focus more on here, why you want to do that. Those are big choices in life that you're going to make. You're going to practice that for 30, 40 years. So, there should be something strong telling you or giving you an idea, or you're still not extremely sure you want to be a basic physician first. That's why you chose internal or family medicine. Those things are fine. But also know a lot of people write about those things. If there's something in you that felt that this is more why you want to do it, there's no harm in mentioning it. And then, why when you have these reviews, That's what people can tell you, this is too much, this doesn't make sense, this is too little. But if you don't put it out there, others won't even find out that this is what you were thinking. So why you wanted to do this in the first place is an important thing, and I would try and mention it because that makes you very different from from everyone else. Because the examples I gave you, like for medicine or someone who grew around you doing all this, those are very common ones. Still works, absolutely still works. Doesn't mean you stop doing it, but if there is something pushing you towards it separately or differently, I would mention it, and then in peer discussion between you, journalist, your reviewer, everyone, if this is apt. Um, and then I'd go towards professional and training, right? So yeah, I want to do this. I want to be a medicine physician. I want to be a surgeon. I want to be a pediatrician. Okay, so you're telling us you want to do this. Now you're at the point of applying for residency. Okay, so this is not a thought that came in your mind in August and you applied in September or October. I'm sure that this thought was going on in your mind for a few months, for a few years, because for international medical graduates, US residency is it's a longer stretched. So you have to have some basic ideas. You did your rotations, which are supposed to be pre-planned months and months, come to the US to do them. Your scores is the same, it's you study the same for everything. You research, you publications. Those things tell you this is why you wanted to do. So here you back yourself that second paragraph, I want to do this. Why I want to do this? Third paragraph, I said I want to do it, but I also worked hard on making sure I develop an application and make an application. This was my interest. So henceforth, I worked a couple of years right outside of medical school in this field to gather more experience. I published here. So you don't go on and on and on because that's your CV for, but you give them a brief idea as to your skills and training in the same field are helpful in saying that, okay, this is what I want to do and I'm already doing it. So it's not like overnight idea came to my mind and I'm like, okay, let's do pediatrics, it does no harm. I like kids. And then in the professional training section, you feel like, yeah, I did two rotation in my medical school, which pushed me towards it. That's something that's not convincing enough. We're talking to program directors, we're talking to people who've been doing this field for 20, 30, 40 years. They're physicians in the first place, so well-respected individuals who worked hard to come here and seen a lot of this. So of course, they're looking for people with interest. The very basic thing when people look for when you're applying for their, residencies, of course, it's a barometer. You have to be smart, you have to do things well. Those are understood. But at least have interest, you know. You can't show in your CV and personal statement that you don't even have interest in this field and you're applying here for whatever sake it is. Those things are, it's not a negative factor, but it's not adding anything in your application. So here you kind of tell them that, I want to do this and I'm doing this for this purpose and I've done this a little bit too. That's where, skills come into play. You can give an example or so, but don't go on and on because that's your CV is about. Um, Fourth, US healthcare. Um, this doesn't have to be a huge paragraph again. This, I would say the second and third one are bigger ones. You can even divide them if it's bigger that you need, there's too much happening. Fourth, if you have a good reason, if there are ways that, people have, we all are humans, we have things going on in our life. My parents moved here when I was so much old. I went back to my home country to my medical school, and I came back here because my parents live here. I always wanted to do US healthcare, or my partner is from here. Those things. I wouldn't go on and on, but I would want to show that you're interested in the US healthcare beyond the personal aspect. um you know that you read books in medical school that you felt like, okay, why is everyone from here doing all this? Or you're very much interested in publications and research, and you read about so many trials and studies are going on here. So you were kind of always curious about it. And this is when you say that you were curious and you were like, why is this happening here and there? This is the next and after this kind of, if you back it up by saying that this is the reason I was interested, and henceforth I submitted an application or submitted poster presentation, submitted this for online. Now the world is so much online. People can just view the conferences which are going on, can submit on conferences. If in the US and you are doing a rotation, you did submit it over here too. So those things again back up the idea that you want to be here, and just because you want to be here, you also worked after that, making sure your application stands, gives an idea as to why you want to be here. So interest in US healthcare. If you have a US master's, definitely mention that. I think one line is absolutely good. Even though it comes in a CV, I think it's a huge factor. It's US, education after your medical school. Any particular reason that made you come here from your home country? It could be anything, like I said, a personal reason, a professional reason. My gist of always doing things is, I start with a professional important reason, and if there is a personal factor to us, I kind of end it at that. Because in life there are personal reasons to do things too, but this should not look like that's the only reason. You can't apply to New York saying that I have 8 family members who live here, so I wanted to be here. No, you should back it up by saying that I have lived here myself. I have done 3 rotations here. I've lived here for 6 months. I like the city lifestyle. Um, I like how metropolitan city is, or so and so university is at the peak of their education and research. So then you can always end that. In addition, I have so many family members, so good family support and all. So that's how I kind of see every time when I talk about something in professional and personal manner. Start professionally and go towards personal aspect. And then last part is, this is the one that you personalize it. Like I said here, if you have a family in the same area, I would 100% mention it. Line, 2 lines, don't go on and on about it. And then, why you're in this individual personal statement, right? If you have these programs, especially the programs you signal or programs you think you know someone from before, very high chances of matching here. This is where I would put a lot of effort and personalize this last 1.5 paragraph. So they do look like, you are thinking about going there for a particular reason. This is a lot of generic stuff for everyone that has to be there. But why these places? Let's say like I gave New York, for example, or I gave Boston, for example. You went there, you did 3 rotations there, you have mentors over there, you are submitting a paper with them over here. You have family and friends over here. So this is the last bottom paragraph where I would say, if you know someone, definitely ask for their permission. If you know someone that you're going to mention their name, mostly if people are at a good level with you, they won't say no. But it's just a good thing. You should be uh, going forward in the ladder. You should do things making sure that you take permissions and don't do incorrect things. So that's your structure, right? Why I want to do medicine, why I thought about doing this, why I want to do this specialty. um I made that decision I want to do specialty. What did I do in my life to make sure that, I back it up? What skills you bring to the table. You may have done residency in your home country. You may have done some rotations here. Just mention it briefly because they come in your CV. You may have done publication and research, again, briefly in your CV, showing that you backed up your interest and why you came to the US healthcare. Could be any reason. Professional trumps personal, but definitely do not miss out on personal. And last one, saying that, why am I targeting your program? Why do I think I am suit the best? This has become more and more important over the years with signaling. Again, if you signal someone, if you email someone, tell them that I'm doing this, I've been here before, I know this, and then you just give them a generic person to everyone else. I don't think that makes sense. None of these things work against you, but if you work hard on making connections, doing research at a place, doing 2 3 rotations in one place, then you're not helping yourself by not putting it over here. People do read this a lot. I can tell you, I've gotten interviews just based on a personal statement on the places that I customized it, especially the last paragraph and in between a few lines here and there. But last one for sure. Okay. So having said that, I said a lot of things. The structure part. Nobody can bring up everything in a day. So I would say pace yourself is super important. Nobody can pen down their best ideas in one day. I don't think anyone can. Some people may say I work better with a deadline. Maybe you do, but I don't think that you can work better in a way that you can finish it. But are you able to qualitatively do as well as you think you should have done? So how I look at it is that, when you get ideas, make notes. Your ideas will not come when you sit on a table and a chair and a table. Your ideas may come when you're rounding in the hospital. Your ideas may come when you're talking to a family member. oh man, this is so hard. I have to pen myself down. Why do you want to do this? You knew I always want to do this. Maybe that's when you're talking to a friend and those ideas pop up. But just write it in your phone notes. It's so convenient. And maybe delve it further slowly and steadily. I'd say this is a process of about 2.5 months. And having said that is only because when you write it, it's the first draft, second draft, third draft, fourth draft, send it to your journalist, send it to your, a reviewer, come back to journalist. Those things also take time. So keep about a month for that. So I'd say that, finish your side of things about a couple of months earlier, if not more. At least start working on it about 2.5, 3 months. I know we're at the brim right now. So basically, at this point of time, I want that you should have some paragraphs aligned, some thoughts already there that this is what I want to do. And people will help you. And don't put too much focus. I have to finish it in this weekend. I don't think that's a good idea at all. I had applied for my fellowship last year and I applied for residency 3 years ago. Fellowship, I took about 2 months. I showed it to my mentors. I showed it to same subspecialty professors. I showed it to the fellows at my hospital. Um, I did my best I could, and I showed it to other people. So everyone will take their own time when you show them stuff. So before that, I want to make sure I'm doing everything right. But I can tell you, I follow the same process. Don't keep talking about your past. Talk about your future, what you're doing right now, what are your plans in the future. That's the stuff that people want to know more. You can give them an idea as to where you came from and why you're doing this, but beyond that, what are your plans? Those things are important. So that's why you need time. Can't do it over a weekend for sure. It takes a lot of days. Focus on a couple of paragraphs, maybe one sitting. That I got great ideas about this paragraph. Let's give everything in this paragraph first. And then maybe I got more ideas about different paragraph and then, do things on those. So yeah, do not do it in a week. Do not do it in a weekend. It's not at all a good idea. Same goes for your CV. Give it time. Ideas don't just flow like that if you want them to flow. Um, some things that I would say that I do, you know, like you have to talk about yourself a little bit. You don't want to be very boastful, but you can't not just talk about anything and just leave everything. So important things that you can do to make sure that your CV, your personal statement, sorry, stands out. The structure, I'd already talked about it. But it should look like it's coming from you. It is very personal. Um, no two people are absolutely alike. So I hope we all know that there's no plagiarism at all. You cannot do that. They run through their filters. I don't know how they work. I have not been into that administrative role in my life yet, but it's not something I would ever do. The moment they feel like you are doing this at this point of life, God knows what you'll do when you become a resident or an attending, because their responsibility, the documentation, they are massive over here after a while. Once you reach the stepping stone, you will realize it. So nobody's gonna bring a person who is gonna put them at risk of getting sued. One line I'll add before this: an attending takes a resident in their team, not someone who's the strongest, the smartest, the most intelligent. An attending takes a resident in the team who they can rely on the most. Okay, who know when there's a problem they can call them, who can manage situations by themselves as much as they can, and then they can rely that if I told you this, you're gonna do that. Okay, that if an attending is sleeping at night, he knows there's someone in the hospital taking care. If you're the smartest but you have no communication skills, you're not reliable, nobody's gonna take you. So, the human aspect of it is extremely important. All right. So it should be your own voice. It should seem like you've written it, it comes from you, and they'll find that out sooner or later. Once they interview, they will find it out. Should not look generic. So it should be your own personal things, going, this is why I wanted to do it. The opening statement, important, is important. Do you want to like completely put something in to grab attention? You can try. But the thing is, you can grab attention with 2 lines. Are you gonna be able to fulfill it? That's what's it, right? The movie did well in the first half, second half was so poor. You can keep someone, ingrained for some time, but their focus may go on later on, will completely go on to something else. So if you're saying like starting with a quote, starting something like completely out of the blue that people are not aware of, um, it's okay to do that as long as you have it in you to continue it in that manner later on, that you can, back yourself. The very simple things of what you write in your CV, personal statement, in talk and interview, is you say things. Nobody's gonna come home to check, oh, did he really save an 18-year-old person when he was in medical school? Nobody's gonna check that. But if you say something, how your body language is, can you confidently back it up? Those are the important things. So similarly, in the opening statement, whatever you say, you're bringing on this, like, like some line to grab attention. Are you able to write about similar things later on, so it looks like, okay, whatever they wrote, like a quote, like honest is the best policy or whatsoever, are they talking about a little bit of it in their personal statement too? You didn't completely forgot about it, because writing one line is not the end of it. Action words, this is something that I would suggest to everybody. So I have a slide that I'll tell you what the action words are after. It it's like basically saying that, like, for example, you have so many publications, you have so many, when you're in medical school, there are so many things going on. You've done, rotations after in the US. You've worked in different hospitals after. How you show that, you've done things. Shouldn't be like, okay, I worked here 3 years as a primary care teacher, this one. So rather than write, I would select, okay, as a primary care physician, I was responsible for, taking care or treating chronic medical illnesses, maybe like, your insulin for this, or your meds for hypertension and all. So there are some verbs that I would say that they kind of shorten each sentence. Like, I conducted this, I organized this, I collaborated on this. Those things kind of show that, okay, he was not just doing the doctor patient work, he was involved in a little bit more administrative stuff, or more things in there, maybe debate school or anything in the medical school a little after that. So this tells us that, you don't have just one vision. You're an, all-rounder when it comes to the field of medicine. And the last is the most important part. Um, what do you bring to the table? This is the part that I would say I would fit in more here. Professions and training. Because you're telling about your skills, right? So what do you bring to the table? For someone who has maybe worked in the military or the army, who's gone around different aspects of their life in their medical school training or before that, what they bring to the table is that they've seen such difficult circumstances that they can take care of emergencies or difficult situations when they're by themselves, because they're good on thinking on their feet and, managing a difficult situation. That's one example of a strength from someone's personal life, what experiences they had. Some other examples could be that you've rotated in different hospitals or different states in the US. So you have done a lot different in different, ethnicities, different backgrounds, West Coast, East Coast. Then someone who's spent 6 months in the New York City, or 6 months in, a different kind of environment. Let's say, I give an example of Boston, or I'm thinking of places which are more IMG friendly. Then chances are that, you bring to the table is that you've seen a lot in that city, how the ethnicity is, how fast-paced the cities are, how the medical system works in that city. You're used to a lot of things in that city, you have friends and family, you have mentors, um, you have the education background from the city, so you know a lot of things over there. So that's another thing to bring up from your personal life and show as in strength that you have. So everyone's different in that way. People have different places, have done different things, they're more adaptable. People have stayed in the same place because you can't hide it. Your CV will show it that all these things you did are actually maybe are more focused on, those particular areas. I would definitely make sure that, when you're writing CVs which are so, like, make sure that this is particularly for this state or this university or that, there you focus on this, that I have done so many rotations here, so I think I'm a good candidate for this place because I know the place, the people, the diseases around and all those areas. Not for every place. That's why you do different personal statements for different subspecialties, and you specifies your personal statement in the last section, the last paragraph I was saying, for different universities. So your skill may be a skill for everyone, or your skill may be a skill for a different set of universities. It depends upon what skill you have and how you think you developed it. It's going to be very different for different places. Just some examples I was giving, right? Like, I You can say I controlled, I customized, formalized plans, spearheaded a division, um, developed, maybe, worked on a grant and developed this for the whole university, regulated some findings or anything. So these are just examples. They come pretty good. Like, Google can be your friend if you use it in the right way. If there is a team management, if you've created something, led a project, you improvised, improved. These things are really important, even in your CV. I would say definitely. This is more so in the CV, but I've used a lot in my personal statement too. It also saves time, saves words. Rather saying, you word it separately. I worked with a team of people where I was responsible for, heading the division. So, like, rather than just cut and write, I spearheaded a 5 to 10% division for this purpose. So that took out those 3, 4 words. So that is important when it comes to personal statement. Um, I'll come to some common mistakes that we do a lot. I'll come to the first point, right? Incorporating CV into the PS. Um, I was saying before, your CV is going to be objective data. Your personal statement is your human aspect. Don't forget your CV, but don't keep adding on it. That I did 6 rotations at 6 places, you name all of them. Absolutely not. You've done maybe a subspecialty here and there, probably the bigger names or something that's more suitable to your personal statement for that particular subspecialty. You can mention that. So I'd say that, don't keep incorporating, but don't forget about it too. If you've done it. Um, I would say it's very important that you think that bigger aspects in your CV that may have changed you in a certain way, why you thought about doing this, because this rotation in your CV kind of helped you towards making sure that you want to do pediatrics or want to do surgery or medicine. So maybe talk about that in a few lines. So that's an important thing that you can do, but don't keep on and on every single rotation that you did. Then repeat information, that's where you proofread again and again, again and again. Make sure that you're not repeating stuff. You get reviews from everyone. That your mind, that's where you listen, like myself, you listen to me in for personal statement, you listen to others for CV, you listen to others for rotations. It's not like I haven't done those things, so I can't talk about those things, or they can't talk about this personal statement. The thing is that everyone brings a different perspective to the table. And it's your job, as this is your life, to see what you can take from everyone. One thing is you get confused because so many people say different things, but if you really narrow it down, what they're trying to say, what may be suitable to your application is going to be important. So rather than repeating things, you show it to different people. When I say people, I mean, in the Sarthi family, mentors you may have, so that they can give you their feedback based on their experience. So that will kind of minimize that from your end too. You may just think about one thing. I became a doctor because everyone's a doctor, or someone died in my family, and there was no doctor around. I felt like this should not happen to others. And all your personal statement, 8 paragraphs, is all about that. So that's just one perspective. Someone who reads from outside will tell you that I think it's good, but you're just so focused on that you're not talking about anything else, any other skills you bring to the table. So that's where this comes into play. Um, why you want to be in that program? If you forget everything I say in this, personal statement line, this interview today, remember, you can forget everything, but remember this: why are you a suitable candidate for them? Period. They should show in your personal statement. This is where I was talking about the third or the fourth paragraphs. That what have you done, your interest, what have you done, and why you're suitable for them. The most important thing, because now this could also be in the end part where you're personalizing these things. Every place is going to be different, why you want to go there. But if you exclude this part, I'd really say that they don't think you're a strong candidate for them, because I was saying in the beginning, the least you can do is show interest. So this has to be there, that why you're a good candidate for them. Can you do it for all 200 places that you're gonna interview, or sorry, apply? Probably not. That's why you kind of you go through your own list, you signal programs, you think this is my most chance for those 20, 25, 15. I would 100% suggest that there should be a part in your personal statement that is like left blank for these 20 places, and you kind of fill it up with your ideas why you're a good candidate for them. Definitely put this in. It's going to be a super important question in your interview as well. Um, why are you different? Everyone is different, right? Where they come from, the education they had, um, why they're suitable for this program. So definitely mention if you think you can have an added on advantage. Sometimes you yourself don't know what your strengths are. So that's why talking to your mentors, talking to people who've done this before, it helps because they can guide you. You don't even realize it, man. You have an engineering degree in the background, you fix things. So, whatever you may go into electrodiagnostics, let's say you're become a neurologist and you want to become an epileptologist, a seizure physician, or EMG physician, there's a lot of technicalities in that. Someone who's done an engineering or who understands these things so well, physics so well, I think it's a very good case that they would do better than others. So that's not an absolute thing, but that's something to think about, that your background really helps where you've come from, what you've done. Um, Completely avoid controversies in politics. We are not here for drama. We're physicians, they're physicians. We're here to make our case why we're suitable for them, and they're here to make sure we're a good candidate for their program. So don't go into those things at all. Don't talk about changing immigration policies. Don't talk about so and so thing happened in the US, shootings and all. I would just avoid it. Let's just not talk about those things. Um,
Uh,
yeah,
Siddhant, let me just interrupt here. Very important this year because this is an election year, and you know how democracies function in an election year. So this is a very appropriate point, and we have special classes on this as well. So keep politics out. This is going to be a very different, every 4 years this happens. So just keep politics out. Sorry,
yeah,
go ahead.
yeah. Thanks. Yeah, absolutely agree with that. Um, some cliches. This is something that I actually learned later on. I think my personal statement also started with a bit of a cliche. Um, I didn't change it too much, to be honest. But when I was talking to a lot of professors of mine here, that, what they read, the ones with the assistant program directors, the first thing they read that, oh, if I see someone who's writing this, oh, I want to do this because my grandfather or grandmother died of a stroke, he's like, I'm not gonna take them. So it's a perspective that I got from at least 2 to 3 different attendings of mine. So I kind of stopped thinking about that at all completely. I applied for a stroke fellowship and I matched at a place, and I didn't do that because I was like, okay, maybe this is an important thing. Just got perspective from someone else. So yeah, I would say that, think differently. Try put in your aspect. Everyone doesn't have to be 100% different, but whatever you think may be important is put it there, and then let, the specialists here guide you as to what may be a good idea, what may not be a good idea.
Yeah, and I do want to again stress, if you enroll with us, we do have a very rigorous process around working with you on your personal statement. So, in addition to several classes, there will be a journalist review twice, as well as a panelist review, where our physician panelists will be assigned to your PS and they will sit down with you, go step by step into each sentence of your PS. So, uh, personal statement is very personal, as the name suggests. So, it is different for everyone, and yes, cliches don't work. So just be aware of that.
Yep. Thank you. Yep. So yeah, those are the important things. Um, I'm gonna just take a few more minutes and then just finish it for us to talk about some questions that you guys have. Um, Here, the first point, trying to force a fellowship. It's just that some of us are super sure about what we want. No man, probably, like lots of people have done research fellowships before they do residencies because they're so sure they want to become a critical care physician, cardiologist, or like different specialties, probably like stroke physician or whatsoever. For them, it's okay. Or if you've done multiple rotations in one subspecialty, knowing that this is what you want, I think it's a decent idea. It's not a bad idea at all, but it's not something you have to do. Think about it. It's not going to be like, oh, this guy's so clear about 8 years down the line, so I should take it. It's not like that. If you're not so sure, it's absolutely okay. So don't force it. Multiple specialties, even if it's internal medicine, family medicine, those are different. I am, and like psych are different. I am neurology are different. Pediatrics and pathology are different. So don't like, maybe some things can be a little similar. Why you became a physician in the first place, that paragraph can stay out, but what have you done to come into this? Like the second paragraph, why I want to be in this subspecialty. The third paragraph, what have I done so that I want to be here? Fourth paragraph here, and the last one, fifth, the personalized part. Those all will pretty much change. So think about it. The example you give in your personal statement about maybe a case you saw or something that led you to do this subspecialty has to change, right? You can't write that this is what made me want to become an internal medicine physician, and then you apply the same to pediatrics. I mean, um, again, it's that makes their job easier. Out of 4,000 applications, they're gonna narrow down to 3,999. It's just easier. Nobody's gonna take you if you're thinking about someone else. Um, Red flags. If you mention a red flag, let's say you have a low score, you failed. I'm not a big fan of mentioning these things. If there is an absolute huge gap in your CV, maybe something to think about, discuss with the mentor if it should be put in there. Small things I wouldn't always mention. I don't want them to think about negative factors. They're already aware of those. If they call you for an interview, they are aware of those. So personal statement, I won't really mention. And if you mention something, mention the learnings, mention the things that you changed after that, mention about how you changed yourself and how different results have come after that. That's more important. If you mention one line about a red flag, which your mentor says, I think it's a huge red flag or it's a big thing in your CV or application that's standing out, let's cover it. It's okay. But mention about how you covered it, what changed, how you changed it, that's more important than telling about the red flag. Don't go on and on. So much thing happened in my family, had to leave education, didn't have the money to do it. One line about that more so later on, I fixed and made sure that I was there for my family, made ends meet, got back into education, finished it, and applied for residency when I felt that I was able to pursue my dream of being in the US. That's the right approach. Okay. Absolute no plagiarism. What percentage is okay? I don't know. I think 10-20% they say. I don't care about it. It's an absolute no. If you don't want your chances to be absolute ruined at this stage, just don't even think about it. Um, you can see things, you can read things, you can develop your own words. The concept or maybe the fact may be a little similar between 10 people, but how you word it should be different. Your friends and all, you care about your friends. A senior shows your personal statement. Two friends show each other personal statement. Do not copy it. It's an absolute no. Both of you will be taken out. They're very strong about these things more than what you may think. So I didn't even, to be honest, I didn't even delve deeper into it that how can I prevent, how much percentage can be prevented? I'm like, absolute no, absolute no. Move on. Simple things, you should proofread it once, twice, three times, show it to maybe a friend or a educator, someone who can, maybe help you with the English there. Make sure there are no typos, you're not overwording. You have these amazing people to help you, your mentors, your journalist. They're there, but they're there to more so help you with the concept, what makes sense or doesn't make sense. You're doing too much, too less, over writing, but your typos, overwording, those things, I think you should do it yourself. This should not be coming to someone else, especially your typos. It's embarrassing that someone has to say that, it should be, the word is non, not no. Let's, for example, a journalist or reviewer telling you this is something that you should take care of yourself. So many applications available now. Make sure that the English is correct. Okay, so this is just save time for them too. If they focus on that, when will they focus on making sure it's not too wordy and it's relevant and not relevant? Okay. Yeah, this is what I've discussed last time too. This is a lot for the interviews that we are all present on paper, and then we meet people and we develop a judgment about them. Who's good, who's bad, who's the right company for me to hang out with, who's the one I would probably call when I'm in need, who's the one I call when I feel like I have a educational question. Similarly, before that, an attending, when he looks at your personal statement, he thinks about it. It's a smart person who knows, who doesn't overwrite, who's putting the right points forward without making a whole jumble of errors. So this guy knows how to do, things precisely, neatly, well. So more than interview, you reach that great, different things, different ballgame altogether. But to reach that, you have to pass these hurdles. And one of the most important hurdles is your personal statement. look at it as a way that you want to show them you're a different person and you're suitable to them. So do not forget about that. That's their first um look into you. So do not, take this lightly at all. So that's where I'll end.
All
And
right. Thank you very much, Siddhant. So, guys, like I said, this is kind of, let's make it a workshop setting kind of a thing. So if you have statements from your personal statement, sentences that you want to review for him to review, just paste it here, right? I will take common questions later on. So on the application and other stuff, but this section we want to just focus on personal statements. So anyone who has sentences from your personal statements that you want a review on, now would be the time. That's the best use. And of course, if you want more specific advice, we have classes and we have our plans where you can get one-on-one complete review. But let me just stop here and see what questions you have on PS so that he can answer. Well, he is an excellent orator. We all know it. So, so he's here to answer your questions. So, but thank you for the compliment to him.
who should review? How many
How
people?
many people should review your personal statement?
Yeah. I'd say that different at different points, right? If you're doing the first few paragraphs, you write a paragraph here and there. You have someone like a senior who you're in good touch with. You have someone like an orator, like an educator in your family. You can show it to them. This is what my mind is thinking about. You kind of make sure that you have a good idea as what you're doing. They can give you guidance. You write about different things, like I said, and once it's absolutely prepared, depends on the kind of plan you have, and I'm sure that these people can help you with that. Most of the times there is a journalist that can help you in the beginning, showing that you're overwording, you're oversharing, you're doing less, you're doing that, and then your mentor or someone that is taking care of you will probably review the medicine aspect for it, that this is more or less, or this you've done too much or too less, and then I think a journalist review again. So
Yep.
but I think this is how things are. So I would just say like that.
So yes, so for those of you who don't know, so we do have a panel of journalists as well. They're all American born, American trained, so they are aware of all these subtle things in the personal statement as a journalist. So your PS will be reviewed twice by such journalists.
See a question here. Can I use ChatGPT to rephrase a line better?
That's a very common question.
Yeah, when I read my personal statement, I put in some lines which I thought could be do better. Think about it. They use some really excellent English to make sure your words are less, but that they do take out the human from it. So it's a good balance, because I did myself about 6 months ago or so. So it's a good balance. The liner here is absolutely fine, but it should not look like a machine is writing for you.
Right. And you should all be aware, just as you have these tools, there are also counter tools. So there are not a lot of software which is available now, which can now assess whether it has been written by a robot, ChatGPT, one of those AI tools. And the other thing which a lot of students miss is when you go for the interview, whether it's remote, online interviewing or in person, if there is no alignment between your personality and what is written on the paper, they will find out. I mean, maybe on paper you are a Shakespeare, right? But when you are articulating, when you are discussing with them, you're not a Shakespeare. Then they find out based on, all of this. And that's a big, big issue. So, like I said, it's a big balance.
Yeah.
Okay, so let's take this question. If I have had no inspiration in medicine, and which is true for a lot of us coming from Asia, parents told you or whatever happened, you went into medicine. is it okay to use sports and connect it with medicine, or what do I do if I have no inspiration?
Let's see, I'm trying to find that question.
So the last question.
Oh, I see. If there's no particular inspiration as such to do medicine, is it okay to do sports and connect it to medicine? Connection depends on you. How well can you connect it? Like I can tell you this from my personal example. I don't come from a physician family. I was a lot into sports when I grew up. Um, did I connect it with sports? To be honest, I didn't really connect it up until my residency. Later on, my fellowship, I connected a little bit because I wanted to do some, um, like procedural work, and I felt that the things I did, like I played a lot of table tennis. I felt very good for hand-eye coordination, so I did that. So for procedure aspect, I think that helped, and I was told that that would help. Purely sports and this, you have to give me an example to say this is correct or incorrect. It's going to be really hard for me to say. Um, if you didn't have any inspiration, I think that's okay, Not everyone comes from a family like that. I didn't have any inspiration why I became a physician. I just felt like I wanted to do some kind of service, and I felt being in medicine was the best I could do. There should be something that made you choose a career of 6 years in India or wherever you are, and then about so much so in the US, leaving your family, starting a new life somewhere. Has to be some pushing point. I feel like if that's really missing, it may lack something important.
Yeah. Uh, can I start? And I'm reading, just randomly these questions. Dharma is asking, can I start my personal statement on a story about my mother's illness, which actually motivated me to become a doctor? But of course, I want to focus on other experiences in my life after starting my journey. The story is like an actual story, and it's very graphic in my head.
Oh, I see. I think that's okay. I mean, as long as it's not something that you keep talking about throughout, if it's in the opening paragraph, maybe two, three lines explaining the whole context and what made you think about why you want to do this, I think that's okay. I think that's fine. Because like I said, everyone's different, right? Some may have no inspiration, some may have this huge thing that happened in their life. I think that's fine. We shouldn't like completely take it out thinking that, oh, it's so common, everyone uses an example. Also depends upon how you use that example and how you explain what you want to do, or how your mind kind of changed that you decided to do this.
Okay.
Okay. There is
All right. So let's review a couple of sentences.
Yeah.
So let's go up, and I'm third from the bottom. Aman, are you able to see his sentence? He's
Let
written it to,
eager. I am
yeah,
eager
yeah.
to. Okay, let's see this. Okay, Aman Kumar writes, I'm eager to join a residency program that prioritizes residents' well-being, fosters a supportive learning environment, and promotes a healthy balance of responsibilities. I acknowledge the challenges of a career in medicine, but are driven by a strong work ethic and unwavering dedication to delivering exceptional patient care. My diverse experiences in medicine have taught me that with persistence, motivation, and commitment to lifelong learning, I can make a meaningful difference in the lives of my patients. It is my dream that none of my patients will ever feel compelled to take a medication without seeking medical advice, and I strive to empower them with knowledge, trust, ensuring they receive comprehensive and safe care. I'm confident that my compassionate care, combined with my strong work habits, make me an ideal candidate for your program. Okay, so let's go back. Okay, I think I think it's well worded. There's no question about that. Um, this looks like you're saying that, all these adjectives you have, which is great. But have you done anything regarding these adjectives in the previous parts of the personal statement? Like, for example, first line, that's fine. We all starts with something generic. That's fine. But now it's coming to this. My diverse experiences in medicine have taught me that with persistence, self-motivation, and commitment to life learning. What diverse experiences? Here you can say my diverse experiences like this, that I'm guessing Aman, you're from India, that working in this place right after medical school, which not so much healthcare options, to going to the US, working in an economically backward surrounding, to maybe working in a metropolitan city like this. So you should add that. I mean, in between a line if needs to be, because this just looks like you're just telling about yourself without showing me that you've actually done it. So if you ask me the wordings, which are fine, absolutely fine, I would definitely cut some things. I think it's very much too many adjectives. Stick to three, four, and then maybe give examples of two. That's how I would do it. I gave you one example already, so I would definitely do that. and it's my dream none of my patients ever feel compelled to take a medication for seeking medical advice. Then here you break again and you say, because I felt like patients who took medications just on the words of the physicians ended up having no compliance later on after they felt the medication didn't help them enough. If you explain to the patient why I'm giving you this, and there are chances you might have to increase or change medication depending on how it suits you, they understand better, they come back to you, and you treat them better. If you just give them something, it doesn't help them, they stop right there. That's the real world, because they don't know, they don't have your training of 10 years. So I mean, if you put it like this, even if you take out 3 lines of these huge adjectives, I would think this is more suitable, that this guy is talking about 6 things about himself. Out of those 6, 3 he's explaining why he thinks those are right. So I would do.
So maybe we'll take one last because we are coming towards the end. So just above this is from Saria Mokhtar, from Sudan. So if you can read that and give some feedback.
Yeah, Saria, bound by tradition yet driven by destiny, I was a young girl tending goats in the heart of Sudan, where I first felt the pulse of medicine. As I grew up with my grandmother, I recall accompanying her on our farm as she tended to the goats. She affectionately called them her little doctor, as I assisted her in delivering baby goats, or called me her little doctor. Okay. Inspired by her knowledge, I worked with her to create healing potions from herbs of her garden. My young mind was already engaged with the practice of taking care of life. My decision to pursue a career in medicine was cemented when I admitted to the hospital due to severe malaria, witnessed a curious, compassionate care coupled with the fascination of the physicians and residents treating a wide range of diseases. I found telemedicine to be the perfect. Well, okay, I think the start what you did with this goat thing is very different. I think I'm okay with that. I think it's a decent idea that why you want to do this. There's a family connection to it. Um, then the internal medicine one, I think that's also okay. I feel like this jump from medicine to internal medicine was maybe a little sooner. I think you can talk like this could be in the second paragraph, the internal medicine line about the malaria and all. The first paragraph you're talking about that how she called you her little doctor. Inspired by her, I think my mind engaged in practice of taking care of life. That's when I, decided I want to be a physician. Now, once I get into medical school, or once I get into school, there is a particular circumstance that happened that led me towards internal medicine. So you can break it down a little bit. So it's not like this huge one big excerpt from your life about first the goats thing and for the internal medicine thing. I think those are different experiences. One led to make you think that you want to be a physician, and then you followed your dream by getting to medical school or by getting good marks, or doing this. And the second part is when you were doing that, you had this experience and you felt internal medicine is helping so much. And then maybe ID, in fact, sorry, no, not ID, um malaria, maybe because you're growing up Sudan, you can say that a lot of um communicable diseases were there. So you felt like, rather than non-communicable that you don't see as much as is communicable in your home country around, you felt that you want to be in this field. So you want to do internal medicine. So you can do that. Yeah. I think
Well, thank you, Siddhant. So, I'm aware of his time, so I think we'll just end here, and I will take other questions. But thank you, Siddhant. This was very, very helpful, and we hope to see you in one of our next webinars. So, thank
all
you
right.
for your time.
Yeah. All right. Perfect. Thank you so much, Mr. Pavan, and thank you everyone for organizing this. And good luck to all the candidates. Like you're saying that, just follow these things that we tell you, work hard, and I'm sure that you will get through. All right.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.